Ladies and gentlemen, good afternoon. My name is Tim Daniel and I'm the Chief Executive Officer of St Vincent's Private Hospital in Sydney. 5 years ago today, we celebrated the opening of St Vincent's Private Community Hospital in Griffith, and I'm pleased to welcome you all here this evening to this very special edition of Inside St Vincent's, celebrating our very special hospital in Griffith. You've just watched the patient journey and some of the daily happenings at St Vincent's Private Community Hospital. And as you can see, what sets our hospital apart is not only the excellent services provided, but our doctors, nurses and staff who do an outstanding job providing warmth, compassion to everyone that enters our care. Over the years, I've been fortunate to see St Vincent's Griffith evolve into more than just a hospital. It's a place for teaching and learning and a place for healing, and certainly a place for our specialists to deliver their care. Although we opened the hospital doors at the end of 2016, discussions and planning began much earlier on. It's difficult to acknowledge the many people that have been involved over the years because there are just so many of you who have contributed to making the hospital what it is today. From the earliest discussions with the prominent people in the local community, such as the late Ray Gamble, the generous donations and clearing of the land by Casella's Spagnolo Trust, the warm and professional partnership with Griffith City Council, particularly Mayor John Delboro, and also Brett Stonestreet and Napoli in her role as chair of the Griffith Health Facilities Fundraising Committee. I also acknowledge the heartfelt commitment from the community to raise more than $1 million, the significant bequest from the late Lavelle Wallace and the many other contributors who have all played their part in giving the community this beautiful and great hospital. It is with your generosity that I also acknowledge the work of the St Vincent's Curran Foundation, who have supported this project from the very early days and work closely with you all. We began discussions between St Vincent's and the community. A few things highlighted the importance of providing the service in Griffith. We already knew that there was a great need for specialist services in the region, and St Vincent's Health Australia had identified a major gap in private healthcare in the area. This was made more obvious to us because we would see many of the people from Griffith and surroundings walk through the corridors at St Vincent's Private Hospital in Sydney almost every day. I'm very grateful and thankful that we still have that very close relationship ongoing as well. St Vincent's and the community also share an incredibly strong and meaningful link, being the values and the missions of the Sisters of Charity, which was really important in our decision in making and for providing the compassionate care to all. With such an evident demand from the community, coupled with engagement from stakeholders and investments from all involved, we quickly saw this would be a regional hospital that would be heavily supported by the region. And thus, we now have St Vincent's Private Community Hospital as we know it today. This evening, you'll be hearing more from our panellists about this small but very special hospital and our ambitious plans to further develop the services into the regional health hub for patients of the Murrumbidgee region. I'd now like to introduce our facilitator, Roy Spagnola, who many of you in Griffith community will know well. Roy, together with John and Joe Casella and their families, have been wonderful supporters of our St Vincent's Private Griffith. Without them and the dream of bringing the hospital to life, it just would not have been possible. I'll now hand over to Roy, who joined us from the hospital's boardroom. Roy, great to see you this evening and thank you very much.
Thank you, Tim. And I'm delighted to welcome you to this evening's forum and would like to introduce you to our St Vincent's team and panellists. On my right here, we have Gabrielle Wood, Dr. Brett Levers, Dr. Oliver Koo, and Associate Professor Andrew Roy on the screen. We'll start with the introductions. We have Gabrielle Wood sitting on my right. She's the General Manager and Director of the Clinical Services at St Vincent's Private Community Hospital here in Griffith. She's a Yenda resident, born and raised here in the area, and a registered nurse with extensive experience. Having spent more than 10 years training and working at St Vincent's Private Hospital, Sydney, Gabby moved back here to Griffith, where she worked as a perio-operative nurse at Griffith Base Hospital. She worked in the role of nurse educator for the Murrumbidgee Local Health District, supporting the professional development of nurses in the region, and is now our leader here at St Vincent's Private in Griffith. Dr. Brett Levers is a head and neck surgeon at St Vincent's Hospitals and consults and operates at St Vincent's in Griffith. He was awarded a fellowship in head and neck surgery by the Royal Australian College of Surgeons and has completed further training in head and neck, oncology and airway surgery. Dr. Levers is trained to manage and treat most ear, nose and throat conditions and also has an interest in benign and malignant lesions of their head and neck and helping a patient through their cancer journey. Dr. Oliver Koo is an orthopaedic surgeon at St Vincent's Hospital and consults and operates at St Vincent's in Griffith. He was awarded a fellowship in orthopaedics by the Royal Australasian College of Surgeons. Dr. Koo has training in arthroscopy and arthroplasty hip, knee and shoulder joint replacements, and arthroscopy, and obtained further training and experience in upper and lower limb surgery, undertaking fellowships in Australia, Italy and Germany. Associate Professor Andrew Roy is an interventional cardiologist at St Vincent's Hospitals and consults in St Vincent's in Griffith. Dr. Roy has extensive training from interventional centres across the world, developing his speciality in interventional cardiology, focusing on complex coronary interventions, transcatheter valve replacements, heart disease interventions, and cardiac CT. Dr. Roy was awarded his fellowship of the European Society of Cardiology and also holds fellowship at the Royal College of Physicians of both Ireland, FRCPI, and Australia, FRACP. Thank you all for joining us. Would you please make them all welcome? Gabby, we've been together on this historical journey from the early discussions about a private hospital in Griffith, through to seeing the hospital open its doors and now celebrating the 5th anniversary. As the General Manager of St Vincent's Private Community Hospital, can you please provide an overview of some of the key achievements of the hospital since opening in 2016?
Thanks, Roy. It's certainly been a journey, but a very important one, and one that I've enjoyed being a part of. Seeing the hospital come to life has been a personal pleasure for me. I will also say I'm extremely proud and honoured to be the General Manager here at St Vincent's in Griffith and lead an incredible team of staff. Since opening our doors to our first patient in late 2016, we have treated more than 10,000 patients in our region. Over the last 5 years, we've introduced more than 25 new specialists to Griffith, covering a wide range of specialties, including ophthalmology, urology, gynecology, dermatology, ENT, orthopaedics, and cardiology. I'd also like to highlight the unique partnerships that we've fostered with the community that is like no other rural private hospital in the country. Partnering with Murrumbidgee Local Health District, Griffith-based hospital, local GPs, our Murrumbidgee primary health networks, other healthcare providers, state government, universities, the list goes on. Importantly, I'd like to mention the Teaching and Learning Centre, the BIATA Murrumbidgee Clinical Teaching and Learning Centre. It's one of the few purpose-built rural education facilities for our training doctors, nurses and allied health staff. This was to ensure that we keep and continue to attract medical workforce to our region for the future. We have supported the training of more than 40 doctors and nursing staff through the BIATA Murrumbidgee Clinical Teaching and Learning Centre. The hospital has steadily increased services over the last 5 years and has also increased in our complexity of surgeries. Our orthopaedic unit has been a great example of this. We're now doing joint replacement surgery every week. Recently, ENT surgery commenced and it was very successful. We are continuing to add vital medical services such as the cardiac diagnostic services that we hope to get up and running very soon, and other services that we'd like to grow. Another very important service at St Vincent's in Griffith is our palliative care unit. To have a dedicated wing at the hospital that not only caters to the special needs of patients, but includes provisions for all of the families that is so important during these episodes of care.
Gabby, you touched on some of the services currently being provided and you mentioned palliative care. I know this is a particular service that has been very meaningful in our community, especially to those patients and their families dealing with the hardship of health and bereavement. Can you elaborate on what types of palliative care support the hospital provides and some of the other initiatives that you and your team have introduced to care for patients?
We've got a well-established multidisciplinary palliative care team. This consists of community palliative care staff, our admitting doctors, nursing and allied health staff, which cover every aspect of the patient's care. This is particularly important as often palliative care patients will spend time being cared for at home as well as in the hospital. It's really important for them to have that continuity of care. Family support is also extremely important during this time, and we are so fortunate that our palliative care wing provides a family room equipped with overnight stay facilities, including ensuite bathrooms, access to meals. Means that the family really can focus on the care of their loved one and not have to worry about the other things that come along with life. We have developed pathways to ensure continued support of staff via training schemes with the Sacred Heart Hospice in Sydney. They're led by the well-known Dr. Richard Chai and his team. Our staff have had many opportunities for training, and this has been well supported by the St Vincent's Curran Foundation, who provide financial support to staff to access the training. There have been many new developments over the last 5 years by way of state-of-the-art equipment purchases to facilitate ongoing developments in our new and existing specialties and surgeries. Some examples of these include diagnostic and treatment options for breast and prostate cancers, and a long list of other equipment that support the ongoing development of specialties. With all of these services, this also means people no longer have to travel out of our region to access specialty care. This means less separation from their families and less time away from their businesses.
Thanks, Gabby. You spoke about the current services being provided at St Vincent's and highlighted cardiology, ENT and orthopaedics. With us today are some of the doctors specialising in these particular services at the St Vincent's Darlinghurst campus in Sydney and transferring their services to St Vincent's here in Griffith. I'd now like to pass the conversation over to our doctors and ask you to give us a brief overview of the current services that you are providing at St Vincent's here in Griffith. We'll start with Dr. Roy joining us virtually from Sydney, and then I'll pass over to Dr. Koo and Dr. Levers, who are in the boardroom here right next to me.
Thanks very much, Roy. At the moment, the services that we're providing from a cardiology point of view are consultation services and assessments for general cardiac care. We provide ECGs, we provide sort of referral pathways for further diagnostic workup, but we have had some limitations without some of the equipment that we've needed probably to be able to centralise care through St Vincent's in Griffith, and so this is part of the exciting future for developing services there.
Yeah, sure. So I'm Oliver Koo, orthopaedic surgeon. So firstly, can I just say congratulations to everyone who's been involved with building such a fantastic facility. Without it, I wouldn't be able to be performing the services that I do, and my patients would still be having to travel away from home to Sydney. So now that this place actually exists and is up and running to such a great standard that it is, I'm able to perform hip replacements, knee replacements, shoulder replacements, deal with the majority of common orthopaedic injuries, which actually are the same thing that I do up in Sydney, and do them at the same level that I'm able to perform in Sydney.
Yeah, Brett Levers, ENT, head and neck. So it's probably a process I started with Gabby and her team here about 2 years ago. And sort of our initial goal over the first year was just to establish a robust outpatient consulting service, which I think we've done very successfully. So at the moment, the service is a monthly service. It can vary between 2 days and 3 or 4 days in the month, depending on whether it's just consulting or there's some operating attached to that. The consulting includes a range of simple office-based diagnostic procedures. So we've brought a nasoendoscope up from Sydney, so it's a flexible high-definition camera that can be put in the nose and throat, and then obviously magnified views of ears to sort of correctly diagnose some of the common problems that we see. Consultations run for about half an hour. They include history examination and basic assessment, and then we can come up and tailor treatment plans from there. More recently, in the last 6 weeks ago, we did our first successful operating list, and that will be hopefully running between every 2 to 3 months at this stage. We'll look at continuing that.
Thank you. We've heard from Tim earlier that St Vincent's identified there was a need for specialist services here in the region. And we know that the area has some of the highest rates of heart disease and other health concerns. What are some of the most common health problems you've observed in the Murrumbidgee region relevant to your speciality since being working here? I might start with Dr. Levers and Dr. Koo, and then we'll go back to Dr. Roy to answer.
Yeah, in terms of common conditions, so I drove out this morning and I was trying to count what I passed, and includes grain, cotton, canola, citrus and wattle, and not surprisingly, the Murrumbidgee corridor has one of the highest rates of inflammatory sinonasal conditions that I know, so allergic rhinitis, hay fever, and the flow-on effects of that. So, the reason ear, nose and throat come under the one specialty is that they're all connected. So people with problems with their nose and sinuses then often have problems with both their ears, their airway isn't what it should be, so sleep apnea and things like that. Common's one side of it, and then the other side is sort of the important or serious conditions that you want to get on and both diagnose and treat earlier. And so that's where the sort of head and neck cancer oncology side of things comes into it. Sort of that classic sort of picture of a head and neck cancer patient, which you see on a cigarette box, is sort of a thing of the past to an extent. It's still part of our practice, but a big part of it now is younger patients. There's a cohort of patients that have virally induced cancers, young people with tumours or growths in their thyroid, salivary glands, and sort of a big part of any sort of young regional population is making sure that we try and capture those patients in a timely manner.
So perhaps you'd like to expand on this and tell us about the current barriers you face in providing your services in Griffith and tackling these health concerns in the region.
Yep. So the barriers have really been equipment based. So some of the things that we're looking at trying to offer, we do need a lot of equipment to be able to provide. So at the moment, what the facility has provided is an outstanding operating suite, ward, set of outpatient rooms that lets us see a lot of the common things. So arthritis, ligament injuries, fractures, worn out joints, people who are having too much pain and not enough function. And the equipment that we have allows us to replace those joints, allows us to fix those ligaments and repair those shoulders. In the future, some of the barriers that we have to expanding those services and looking at doing different things means that we need to expand the type of equipment that we have. Orthopaedics is very intensive in what we need, and we often need plan A, plan B, all the way through to plan C, D, E, and F. And that means we need to have the right hardware there to enact that plan. And when you're operating on someone and you need to change plans, you need to have ordered that equipment in advance, have it sterilised and have it in the room available to be able to be used. So there are some changes in the equipment which is available that we would require so that we could expand our services to take on such things as trauma, to take on more broken bones, fractured neck of femurs, particularly for the elderly.
Yeah, I think a similar sentiment. ENT patients you meet and see who often come in quite anxious in that, their face is what they present to the world, and anything we look at doing needs to try and preserve that, which generally means I'm operating down a small hole, whether it be the ear, nose or mouth. And so the equipment we use is quite specialised, technical, sort of high definition telescopes, instruments that have been designed to sort of go down a small hole and then be opened, manipulated, and sort of that minimally invasive type approach. And so I think some of the initial barriers to opening up the operative service have been sort of acquisition of that equipment, but we're sort of making slow progress on that front. We've procured an examination chair here now, which certainly helps, and more recently have started to sort of obtain some of the equipment we need to be doing the operations. So.
Okay. And Dr. Roy?
Yeah, thanks, Ray. I mean, as you mentioned, the statistics for heart disease, and certainly in the Murrumbidgee and Riverina region, are pretty grim. And I think the sort of ratings over the last decade have been in the top 10% of the whole of the state. And, this is due to a number of different factors. But, as a result of heart disease, there's, high incidence of heart attacks, a lot of atrial fibrillation, strokes, but also just a lot of risk factors that are very prominent and probably, are quite difficult to manage due to strain on services as well. And so I suppose, part of the barriers at the moment is that there's still a lot of strain on local services. From our point of view as well, there are some limitations in the diagnostic diagnostics that we can provide due to equipment limitations, and you know, we're really hoping to try and put together a proper service, not only at the diagnostic and reactive side of things, but also in the preventative area of heart disease prevention as well, because I think, you know, that forms a huge part of overall cardiovascular care.
Thank you. Now, we've learned today that much of the focus over the past 5 years has been on developing the services and overcoming some of the barriers that come with providing private healthcare in a regional setting. And I'd like to congratulate everyone involved for what's achieved. No one believed that you would have got to this point, we started from zero, we've got to here. It's, you know, it's fantastic. Congratulations to everyone. Now we'd like to imagine and to fast forward. You've got the credibility now. You've shown what you've done in the last 5 years. We are 5 years down the track. We've got runs on the board. People can believe it now, where before most people thought it was a reality and a dream that had realised. Now I'd like to direct the discussion towards the next 5 years of St. Vincent's and what this might look like. Gabby, I'll start with you. And perhaps you want to share a bit more about the plans to focus on the hospital as a regional health hub.
Thanks, Roy. That's right. Our goal over the next 5 years is to establish a regional health hub. And that's about continuing to upgrade our current services to the next level, with a particular focus on ENT, orthopaedics, and cardiology. We hope to expand in all of those areas with orthopaedics in mind, the possible development of a fracture clinic, including the rehabilitation and physiotherapy services that go along with that. While we're only focusing on the 3 subspecialties today, we'd also like to further develop our existing specialties. These vital services will be led by a number of the clinicians coming from St Vincent's Darlinghurst campus, along with our local providers, and hopefully provide some ongoing care for our patients, offering the best healthcare services in a regional setting. We're also excited to announce the development of the Heart Health Centre, led by Associate Professor Andrew Roy. Given there's a serious need for heart health care and awareness in our region, as he's just outlined, with all of these exciting initiatives also comes a task of providing funding to get these services up and running. While we've made the commitment to now introduce these, there are certain startup costs that we would need to cover as a hospital. This is where we again are asking the community to help fund some of these projects. Where your support can help most is through funding the equipment. Things such as the Heart Health Hub, and as Oliver and Brett have described today, the equipment required for their specialty surgeries. We also need funding to continue training and upskilling our staff to improve our care, but provide the consistent care that we're already providing. We've had a very strong partnership with St Vincent's Curran Foundation since the very beginning of St Vincent's in Griffith, and we'll be working together again in the hope to raise the funds that we need. I should mention that all donations at any level really help us out, and the support of the community goes a long way to the greatest areas of need.
Well, in Griffith, we're probably not the healthiest of eaters. We all love our salami, and we probably turn the food triangle around the other way, and our cholesterol is probably not the best. So it's probably a good time to pass to Dr. Roy and your mention of the Heart Health Centre. And can you share some further insight into what the Heart Health Centre is and what you hope to achieve?
Yeah, thanks. Well, the first idea is that we're aiming to put in sort of a full, complete set of diagnostic equipment, including a stress test machine, an echo machine, plus blood pressure monitors and all of the other cardiac rhythm monitoring, and that will form, you know, the cornerstone of the diagnostics. But that'll also help us support some higher acuity care in the hospital itself as well, and provide support services for the anaesthetic and the surgical teams. We're also providing specialist support on a weekly basis, and so there'll be a sort of a much more enhanced continuity of care. And that's on the one hand, again, as I was mentioning before, at the diagnostic end, and of course we're working in partnership with our partner GPs and also Allied Health. But as part of an overall heart health care service, our idea is also to provide some heart health programs, so some enhanced sort of risk factor management, such as lipid management, blood pressure management, and some heart health programs with engagement with the community. We've got some exciting partnerships with the Heart Foundation to be leading some of the regional programs at the moment, such as the My Heart, My Life program, and you'll see a bit more about that, but also Young Hearts and also heart disease education for women in particular. And there's some other working group collaborations as well. And I think it's also important for the Heart Health Centre for us to think a little bit about research associations and patient-centred outcomes. So we do actually intend to create some research collaborations to try and look at some of these outcomes. So there's some pretty exciting times over the next 5 years, and I think St Vincent's Hospital campus in general has had a very, very strong cardiac service for the last 50 or more years, and the idea is that we can try and enhance that and bring it into the 21st century and hopefully provide some better outcomes and try and improve the heart disease rates and other cardiovascular problems that currently occur.
Thank you. I'd now like to ask Dr. Levers about the future plans for our ENT speciality. You mentioned increasing the complexity of services and especially diagnostics for head and neck cancers. That's something that I've had the service of and really happy with the service, and thank you for that, you and your team. It's great to have that service here. Why is a diagnostic service so important, and how do you plan to extend your current ENT consulting and surgeries in the areas of cancer?
Okay. But from a non-cancerous point of view, just increasing consistency with the service that you provide the community, not dissimilar to orthopaedics and Harold was talking earlier. These aren't necessarily things that are life-threatening, but they impact on one's quality of life, and the sooner that you can institute non-surgical and surgical options, the better for the patient. With regards to the cancer services, as you alluded to, St Vincent's, and particularly through one of my senior colleagues, Richard Gallagher, have had 2 decades now providing head and neck cancer services to the Murrumbidgee region. And that's certainly something that we're trying to expand and I think constantly improve on. I think it's probably not until someone has a cancer or a tumour that they understand the process better, but it's not just about an operation, it's a journey. And that journey starts with a diagnosis, and I think by bringing a service to Griffith, the goal is that that diagnosis occurs earlier. The earlier you get to a cancer diagnosis for most areas of the body, but particularly head and neck, the better your outcome will be. So the sooner we can pick up these problems, the better. I would like to think that over the coming 5 to 10 years, we start to offer more complex procedures here at Griffith. There's no reason we shouldn't be striving for that. The relationship the hospital has here with their primary care providers and GPs it's just tailor-made for that type of model. And then probably a big part of it is what we call survivorship and surveillance. So after you've had your head and neck cancer or treatment, as you said earlier, there's people going constantly back and forth to Sydney to be reviewed, to make sure everything's all right, to be having their tests done afterwards. And the more that we can bring that to the hospital here and the surrounding community, the far easier it is to manage the journey that they've been through. So in terms of, I suppose, the vision for the 5 years is to simplify that process for regional patients: diagnosis, treatment, and surveillance, all 3 phases.
Thanks, Dr. Lever. Now I might pass on to Dr. Koo. Dr. Koo, as we know, he put his money where his mouth is. He's bought a property across the road from the hospital, so it shows a commitment. Not only we've got people travelling backwards and forwards and the connection with St Vincent's in Sydney, St Vincent's in Griffith, we've also got the commitment of people actually spending more time here, and we thank you for that. My wife's also used your services. I'm very happy. I'd like to, if you could now provide an overview on the orthopaedic services and what you hope to achieve in the next 5 years as well. And like you currently provide most orthopaedic surgeries like hip and knee replacements, what do you see could help extend your services in the region, and what type of support services does this involve?
Yep. Well, I think a bigger fridge for my salami, because it is overflowing at the moment. And for services, I think that's really it. It's more. I can do more. I can help more, and I know that there's the need. There are different types of injuries. There are different types of orthopaedic problems that at the moment we have the technical skill to do it. We do it in Sydney. We do it at St Vincent's Public. We do it at St Vincent's Private. And I hope to be able to offer those same services that I do in Sydney here. We've come a very long way, as I said before. The facility which exists is outstanding. That I would easily argue that my patients in Sydney should jump on a Rex flight and have surgery performed here. That I look in surrounding areas and there should be reverse flow. Yeah, so I know the patients who actually leave and go to a different area, it should be the opposite way around. There is no reason to think why patients who leave this town to have services elsewhere, other people from other towns, should actually be doing the same thing. They should be leaving their town to come to this facility and have their service provided here. Some of the things that I hope over the next 5 and 10 years is to be able to provide a complete service. So like I say, that at the moment we're with a few changes, and it's very simple. There are a few simple equipment changes that are needed to allow me to do what we've been trained to do. As a simple example, if someone breaks a hip, the actual beds that we position people on to perform that surgery, there's a piece that we don't have. And that means that even if we're all here, even if we actually have the equipment to actually fix that broken bone, we actually can't place that patient on the table properly to perform that service. So there are some really basic things that if existed, we could actually stop that lady having to be transported 2 hours by road with a broken hip to be fixed. And I think that that's something that everyone looks forward to achieving over the next 5 and 10 years.
Thank you. So, Tim, you and Gabby both touched on the Beata Murrumbidgee Clinical Teaching and Learning Centre and the importance of this in training and retraining doctors and staff to live and work in the region. We know the centre is already training staff in many different areas. Can you share any further insight into what is planned to extend the teaching and learning services? Maybe Tim might start.
Thanks very much, Roy. I mean, it's a really exciting opportunity to bring some of Australia's leading specialists to Griffith, and you can hear the real keenness to actually be in the area, to work on people locally and look after them locally. I think, you know, that's not a common theme across the rural communities in Australia, and in fact in many countries, to have specialists of this calibre who are racing to the beautiful Griffith area, who are keen to look after the people in Griffith. So it's just so exciting. So what can we do as a hospital? What we can do is make sure that we're improving the other services that actually support our specialists. And we're talking about allied health services, physio, occupational therapy, dietetics, speech therapy, things that actually we can also help to support from Sydney and add to those training areas as well. And particularly also nurse education and support. We've already run some rotations of our staff through Griffith and we learn as much as we from both sides. You know, it's not just a one-way street. We learn a lot from each other, and we're very keen to continue those nursing rotations the new grad programs to make sure that, again, we're bringing young nurses, all nurses, anyone who wants to nurse for that matter, into an area of expertise and to be able to underpin the incredible support that our specialists are delivering. Gabby, you've got probably a couple of things as well.
Thanks, Tim. Yeah, I guess I'll just touch a little bit more on the training programs for nursing staff. We currently, and have done for some time now, support the EN programs through our local TAFE. We see regular TAFE students come through, and thankfully we get to see them right through their training, right until they become fully qualified. This year we've also engaged with a school-based program. So with the local high school here, we've taken on 2 training AINs. They are actually employed by St Vincent's, and within 12 months, they'll have their certificate along with their HSC. So that's been a great incentive. Medical students continue to utilise the teaching facility and work alongside our specialists, and we hope that we attract them back to the area.
Thank you. We might go to questions now from the audience. We're getting a lot coming through, so if we won't be able to answer all of them in the time committed, but the team at the foundation will endeavour to respond to the questions not addressed here today. So what question do we have here, Gab? Yeah. When you visit Griffith to consult and operate, how often do you visit Griffith and how long do you stay to see the patient? So someone might want to comment on that.
Yeah. So it depends on the month, but generally at the moment I consult Thursday, Fridays. Pre-COVID, I was bringing the family down and we were trying to hang around for the weekend and things. That isn't happening at the moment, so I generally try and make my way back to Sydney on a Friday evening. But when I'm consulting, I'm down here for 2 full days. The way we've set it up, when I operate, I'll operate at the beginning of the week and then stay for the remainder of the week consulting, and that way sort of any immediate sort of post-operative issues I'm around to iron out, so to speak. And then on months that I've operated, I then make an extra trip back in that month to see those patients that are being operated on, because generally waiting the 4 weeks is a bit too long. So I'm usually back about 2 weeks after I've done an operating session.
I'm here every week. I'm here most weekends because my fruit trees and vegetable garden need to be tended to. When I actually probably spend more time in Griffith than I do in Sydney, so you could probably think that I'm actually a Griffith surgeon who moves to Sydney to go to the public hospital in St Vincent's Private in Sydney.
Thank you. Dr. Roy?
So our Heart Health Centre will be staffed by myself, my brother David, one of our other cardiology, electrophysiology colleagues, and probably one of our heart failure physicians. So we'll be doing consultations probably 2 days a week, rotating between the different specialists.
Yeah, thank you. Another question here asks, can the doctors tell us what can be done to improve heart health, ENT health? That we haven't already answered.
Andrew, do you like?
Yeah. Well, look, I mean, I suppose it's sort of more of a general comment. The first thing would be trying to improve your exercise programs, and we'd usually recommend 5 days of exercise, 30 minutes per session. Improving your cholesterol, improving your blood pressure. If you do have a family history of coronary disease, then particularly in a first degree relative, then going down to get all your lipid and your risk factors checked out at an early age. We know that even for some people, they can develop abnormal lipids and coronary disease in their 20s and 30s, and also addressing other risk factors like stopping smoking, trying to control any diabetes that may be present. So there's a number of sort of upfront risk modifiers, and then the idea is also to seek earlier assistance for working out whether or not you may have subclinical coronary artery disease that may respond very well to lifestyle optimization, possibly medications before any problems arise.
Thank you. Something else here, someone's asked, you've answered part of it. The Heart Health Centre sounds very exciting, and we're all excited about that. They're saying, do you have any additional lifestyle advice on how they can look after their hearts a bit better and their health a bit better?
Well, put it this way, I'll still be going to the Salami Festival again myself when things open up, and there's still a few of the vineyards that I need to visit. So it's all relative. But I think that, the Heart Foundation website has very, very extensive information about key objective parameters goals to try and achieve. But, we talk about the Mediterranean style diet, so less red meat, more fish, more white meats, more olive oils, and some of those factors constitute some of the Italian sort of dietary factors that plenty of people would be familiar with in Griffith. But it's never just diet; it's a combination of exercise, diet, and then sometimes even despite those factors, there may still be other genetic factors at play that need addressing.
Yeah, thank you for that. A fracture and broken bones. Can we get some updates on this service?
Yeah, so
I think that might be a question for you.
Yeah, so absolutely. So I currently already, if you've got a broken bone, fracture, same thing. You can just get in touch and we can see you already. I accept all referrals. I think what we're talking about is about basically what things can be actually treated with operative surgery at the hospital. Not everything needs operative surgery, so not everything needs to have us actually have someone come through the hospital for surgery. It can be that they're treated with non-operative managements, and even with elective things, even with arthritis, we always maximise non-operative management for people. So if you do have a fracture or know someone who does have one, their GP can refer them to me already. If they are able to have and want their surgery done through St Vincent's, we actually can facilitate that currently. There's just a couple of large types of equipment that bigger types of surgery would need a larger hospital or this different equipment to perform. So at the moment, it can be very simple to think of it. If you've got things like a broken collarbone, a broken wrist, a broken ankle, patellas, kneecaps, those sorts of things are probably the most suited for surgery here at the moment.
Thank you. A question here for Gabby. It's saying, how do we cope here for the COVID? We seem to have done a great job so far. And what are the plans? We don't know what a crystal ball is going to have, but if we do end up with cases here, can we deal with them? And the advantage of people, they say here, there's a great advantage on people being able to do stuff here rather than taking the risk and travelling, coming back, isolating and so forth. Do you want to just...
Yeah, that's actually really good question and an important one for our region, especially in these times. Sydney, as we know, is inundated a little bit at the moment, so we're reluctant to travel up there if we're well to get healthcare that we could otherwise have here locally. Part of our COVID response locally is very much tied in with our local base hospital, and I think it's important to again talk about those partnerships that we have, and it will form part of the health hub of Griffith. We are really unique in that setting and that collaborative relationship. So should we see COVID patients in Griffith, the first response will be at the base hospital, but importantly, part of the step plan to manage those, St Vincent's would come on board and take what we call the clean site. I might hesitate with that word, but we do need a place to put patients that aren't affected by COVID and that need a safe place to recover or have procedures that can't wait. And equally important is that they're not having to travel up to Sydney. They don't have family support. A lot of patients need carers and all sorts of things like that. And when they come back home, they're having to isolate or manage those restrictions as well. So I think it's really been extremely important that we've still had our services provided here by our specialists. That has been risk managed with lots of testing, pre-testing and isolating of our doctors before they come. So it's, it's been, they're quite dedicated, and I'm really pleased that we've been able to still provide that service.
Yeah, thank you, and I'm sure everyone would agree on what an excellent service you have done, and I know it adds an extra layer of complexity, an extra layer of work, but you've managed that well, and that's good. And that's what people got to remember too. This is a community hospital. It's not like people thought it's only for this person or that person. We work in conjunction with the base hospital. I believe with the new hospital going up, that will be better for the whole community. You'll work together. There's a passageway or a tunnel that's going in. They will make it easier for patients to come from one to the other without having to drive around or whatever. So that's, I think, what it's all about. It's a partnership. It's a council. It's a local community. It's business people. It's St. Vincent's in Sydney, and it's us here.
Yeah, it's quite a collection of people.
I think we might, with the rest of the questions, we might just answer them back later. I think we just answered a bit that. How do we interact with the nearby public hospital? I think we just sort of spoke on that, unless you want to add on any more of that. So I think the rest of the questions we'll endeavour to get back to everyone. At this point, I think we'd like to thank the panellists tonight: Tim, Daniel, Gabby Wood, Andrew Roy, Brett Lever and Oliver Koo for their taking time out of their busy schedules and offering their expertise to shed light on the work that they are doing to continue providing exceptional healthcare in our community. And we're so lucky to have that here. I'd also like to take the opportunity to thank the wonderful doctors, nurses and staff at St. Vincent's in Griffith who continue to care for our community. Most people in our town have dealt with you as patients or as family members of loved ones, and your compassionate and outstanding level of care leaves a lasting effect on all of us who visit St. Vincent's. Like, I get calls all the time. I've been to the hospital, it's so great. We had the service of the palliative care, that was so nice. I've had that myself with my mother. Like, all we get is positive reports all the time, and that's a good testimony. As a community, we are so proud to see the hospital. We have all championed for it and provide excellent care for all of us. And St. Vincent's, a team, they work very hard. They've got good work ethics. They also like to party very hard. And they're very upset that they weren't here to celebrate the 5 years, like to have an event of the 5 years in the Griffith, and we hope that we can host a belated anniversary in 2022 where the team can all come and party together like they used to be able to. In closing, St. Vincent's Current Foundation will soon be launching a fundraising campaign to raise $5 million over the next 5 years to support private community hospital as a regional hub, implementing and developing these services that we heard about this evening. Although it might sound like a lot of money, it's $1 million a year between the whole community over the next 5 years. We've done the last 5 years, I think we would have raised round figures like close to 30,000 in collaboration with the government, the council, businesses and local people. So $1 million a year between everyone, I don't think it's a big ask. And now when we ask them for it, or when I say we can show that there's a reason and there's results. Where when we first were raising money, everyone was sceptical that, nothing was going to happen and it wouldn't be possible, where it is possible. And these are the type of things that we've got. So if you are in a position to support, whatever way that you can, I encourage you to contact Kate Groves at the foundation to find out more, and you'll see the details on the screen shortly, because if everyone does a little bit, it adds up to a lot. And if you just got to look what you say, besides the health risk, what you say when you go to Sydney to see Tim's hospital, you pay accommodation, you pay travel, you pay food because you got to eat out. Your family either got to be away with you, or you got to take time off work, or they got to come with you, or you're on your own. Doing it here, we save that much. So if everyone could just put a little bit, it's not going to be that much, and we'll get a better facility for all of us. We'd like to thank you all again for tuning in today and for your support in many ways. And I'd like to close with a very happy anniversary to St. Vincent's Private Community Hospital in Griffith, and all the best for the future.
Thanks, Roy.
And we're on time.
Thanks, guys.